Thanks, everybody. Yeah, just very briefly. So I'm Pete from Stryker, one of the companies at the back. There's a whole range of things that Stryker do. I'm with Interventional Spine. One of the procedures that we help out with is vertebral augmentation, and two or three different products that work for it. The reason I thought it might be useful for you guys here to just run through this is you probably do come across some of these patients out in the community. My day-to-day job is actually working to help improve the pathway within hospitals, so within patients, working primarily with kind of radiology, care of the elderly departments and medical divisions, where a lot of these patients end up sitting sometimes for 2 or 3 weeks in pain. So what is a vertebral compression fracture, which is what we're talking about? It's, again, the clue's in the name, a compression fracture of the spine. Usually occurring after a traumatic incident. It can happen to anybody, so if you get a high enough trauma, a healthy spine will still compress and you can get a fracture. Most commonly, though, it happens really with osteoporotics, so particularly in elderly patients where the bone quality is not as good, and then sometimes even just stepping down too suddenly can create a traumatic fracture of the spine. Can also happen with cancer as well. They have a major impact and can have a major impact on an individual's quality of life, so causing back pain, loss of height, deformity, immobility. It's dramatically different though, depending on the patient. A young, fit, healthy person, male or female, if they can tolerate the pain, can actually walk around with this, the back will heal, and if the kyphosis is not too bad, there's really no huge problem. But particularly as people get elderly, and particularly the more frail patients, it does become a huge problem because the pain isn't as bearable, and it becomes really difficult for them to mobilise. And you have particular problems with people not being able to walk around, muscle wastage, issues connected with that. Procedurally, there's a number of things that can work. I mean, ultimately, if one of these fractures is really bad and is immobile, then it can be a case for the pedicle screws that you've seen earlier. But in a lot of cases, if it's just traumatic and very, very painful, and we can identify the pain, usually with an MRI scan, doing a stir sequence, and if you can see edema there, it's usually an indication that the pain is from the mechanical injury. Then needles can be put down the pedicle in a similar way to the screws that you saw earlier, and cement can be put into the vertebra. Again, if the collapse is not too bad, you can simply put in cement, and that will, if you're selecting the correct patients, the results can be really dramatic. A lot of patients having this procedure, if the fracture is the cause of the pain, will go home the next day. It's done in the NHS, but it is a service that's offered privately, and so spine surgeons and radiologists can do them in private settings as well. In terms of patients, how many patients does this affect? A lot, a huge number. So this is just data from back in 2022, and this is average for any year that you look at. So in Sussex hospitals, nearly 800 patients have been admitted to a hospital with one of these fractures, and this is data for inpatients that have remained there without any other treatment. They've just been there kind of in pain until they've left, basically. And that's just inpatients. So there is a huge and an even greater number of these out in the community who are going to GPs, sometimes going home and just lying in bed. Again, the key in this is the patient selection. It's not that there are 800 patients that should receive this treatment. That's not what we're saying. But there is a significant number that would do very well with that procedure if they're able to get it, both in patients and out in the community. So it's something that's worth knowing about, worth understanding, and if you have or see people that you suspect this is a problem, then it's worth referring them through for being worked up to it. But thanks very much for your time. Thank you, everyone.
Thank you, Pete. Thank you. Nice to look at the time.